please take your time. We're here for you.
I have a thought. My name is Alejandra Alvarado. I am 18. I have a daughter named Giselle and a son named Angel. My daughter is 4, and my son is 3. I had my daughter at 13. And my son at 15. Without the help of the father with AFLP, I was able to get resources to help me back in school because I did not want to give up on them and their future. They helped me by supplying us with diapers, support with resources such as housing, food, any resource we needed. They'll find a way to help us. They helped me enroll into college, and now I'm at Mary College finishing my first year, and I want to do ultrasound tech. And please restore AFLP. Thank you.
Thank you for sharing your story.
Good afternoon, Madam Chair and members. Paul Neprath, representing Planned Parenthood affiliates of California. We have about 114 health centers throughout the state of California. And, well, I wanted to add our support to the courageous, young, accomplished women who just spoke to you, and the program that they are representing. Planned Parenthood also has teen success programs that help teen parents accomplish their goals and graduate from high school and go on to college and things like that. There are a few other programs that we'd like to weigh in on here and appreciate the time for us to look at investment back into the people of California. The Black Infant Health Program is one that we'd like to associate our support with. This seems like a small investment with a great return. You're going to hear a little bit more in detail about the STD program and the proposal before you. We think that's a smart program. California has several counties that are exploding with high rates of sexually transmitted infections. We got to do more about addressing this issue, and we think that this is a smart proposal to put a couple of $1 million into a couple of pilot places where we might be able to reverse some of the trends that are going on there. The primary care rate bump is critical to Planned Parenthood. Is this mic on, or is it?
I can hear you. Yes.
Okay. So the primary rate bump is critical to Planned Parenthood. We are the rate increase is critical for expanding access. We are currently working with our provider partners in Washington, trying to extend this program beyond 2014 when it expires this year. We would hope to get the federal government to extend this, and the state would have to pick up the costs as it's being proposed here. But should it not be extended at the federal level, we obviously think that this is an important thing for Californians and for the Medi-Cal population, for providers to be able to be in this program effectively. So that's something that's very important to Planned Parenthood affiliates. The teen pregnancy prevention programs are critical. In the early 90s, the state made investments into the teen pregnancy prevention programs. By the mid-2000s, there was a dramatic decrease in teen pregnancy, unintended teen pregnancies, 53%, higher than any other state. And then between 2008 and 2011, we started cutting these programs back. We understand why, the terrible recession in California, but it's time to rebuild these programs, and we're afraid that should we not rebuild these programs, that we're going to see reversing of the trends that have brought us to a good place with teen pregnancies prevention programs. So those are our issues, and we appreciate your consideration. Thank you.
Thank you very much.
Good afternoon, Madam Chair and members of the committee. My name is Amy Moy, and I'm with California Family Health Council, a statewide organization that champions and promotes quality sexual and reproductive health care for all. And as a mom and an advocate, it's unfortunate they left. I just wanted to express my appreciation and admiration for the moms that shared their stories about how ALFP helped them. I'm here with our mission in mind to express on record support for refunding teen pregnancy prevention programs, also funding for school-based health centers as key access points for quality and sexual and reproductive health care for adolescents, and also the rate bump for Medi-Cal providers. We need to make sure that coverage equals access, and making sure that Medi-Cal recipients have a place to go is critical. But mainly I'm here to urge the state to address the STD public health crisis that we have in the state right now. We know from recently released data from the CDC that rates of STDs are at an alarming rise across the country, and that a kind of epidemic proportion rise in STD rates is being mirrored here in California and nationally and statewide, really disproportionately impacting youth aged 15 to 24, as well as youth of color and men who have sex with men. And we are asking for a modest short-term investment to address this acute public health crisis. And we are for a long-term public health benefit. So we're open to working with the administration and staff to figure out the best way to allocate $2 million a year over a short-term period with a pilot to see if we can smartly and wisely impact STD rates and where they would have the most return on investment. So we urge you to consider, I know there are a lot of public health priorities, but urge to consider this issue of addressing this acute public health crisis for this communicable diseases that don't know boundaries between geography, age, or healthcare coverage. Thank you.
Thank you very much.
Thank you for holding this hearing. My name is Laura Thomas. I'm the Deputy State Director for California for the Drug Policy Alliance, and I'm speaking on behalf of the Drug Overdose Grant Program. We're asking for an investment of $2 million to be spent over 3 years in a grants program to go to local health departments, community-based organizations, and local law enforcement. Accidental drug overdose is now the leading cause of accidental death in the state of California. In the last few years, it has overtaken motor vehicle accidents as the leading cause of accidental death. We have appropriately invested significant amounts of money in reducing motor vehicle deaths, making highways safer, cars safer, improving medical response. And while those deaths have gone down, what has happened is that drug overdose deaths have risen at the same time. So in the last few years, as the California state budget has been cut, we've been seeing an increasing, skyrocketing number of deaths. This year, approximately 3,000 Californians will lose their lives to drug overdose. And fortunately, we have a very safe and effective antidote to an opiate drug overdose called naloxone. It's a safe, effective, non-toxic generic that's been in use since the 70s, and lay people, friends and family members have been trained in how to administer it. So our proposal is for a grant program that would work with existing programs around the state and existing models to provide them with naloxone and the capacity to train friends and family members of people who are using drugs, whether prescribed or illicitly, to prevent death. And we would also like to strongly support reinstating the syringe access funds for HIV and hepatitis C prevention. Thank you.
Thank you very much.
Thank you, Madam Chair. I'm Loretta DeLestro from Ventura County, and I'm here to ask for your help in funding overdose prevention with naloxone kits. This is what a naloxone kit looks like. I know firsthand of the devastation of an overdose. After 5 years of struggling with addiction, of being in and out of treatment, years of doing everything we could possibly think of as a family, my only son, John, overdosed. Like many other families, we found him dead in his bedroom. The problem in Ventura County and all over California is addiction to opioid pills leading to overdose or leading to the much cheaper heroin and overdose. These deaths are preventable. I'm proof that a naloxone program can work. In my grief, I researched. I found a program in Los Angeles, coordinated a naloxone training for high-risk kids and their parents in my home, and some people drove for hours. They were educated on how to prevent an overdose, how to respond if they see one, and how to administer naloxone, and left with their own kits. As a result, 2 young adults' lives were saved. At a suburban home in Ventura County, one mom saved her own daughter, the other saved a friend of her daughter's, and called 911. Word of this spread, and I became a trainer myself at my own expense. Now our communities are demanding overdose prevention and naloxone programs. Every life saved means a family is saved. Consider that some people cannot survive the loss of a child. Marriages fail, divorce, the cost of divorce, job loss, sometimes even home loss. Brothers and sisters watch their parents just fall into a descent of lifetime of depression. The cost of an naloxone kit is $25 to $40. A funeral is $10,000 to $12,000, regardless of your denomination. I know. And also the toll on our firemen and our police, who almost daily have to say, I'm sorry, but your child passed away. Fund generously for our families, please. When our child dies, we're never the same. We're broken beyond repair. We want to be broken no more. And we want to protect other families. We need state funding for overdose prevention. To do that, I thank you from the bottom of my heart.
Thank you very much for your courage.
Hi, my name is Amal Fatah, and I'm a caregiver. I'm here to ask for the restoration, and I'm an advocate for the Caregiver Resource Center funds. I'm going to talk about my own personal experience. I am a caregiver, not to one, but to two aging ill parents. My 82-year-old father has stage 6 Alzheimer, and my 78-year-old mother has heart disease in addition to many other health issues. It started many years ago. I had to step in to fill the gaps. I did everything. There were times when I felt overwhelmingly stressed, depressed, and alone. I didn't have time to take care of my family or myself. 3 years ago, while searching for help online, I came across Del Oro. Since contacting them, I have had tremendous help and support throughout my journey as a caregiver. They have allowed me to have just a little more balance in my life. And if I were doing it alone, physically, mentally, and emotionally, things have been easier with the help of Del Oro in my life and the life of my parents. Del Oro provided respite help so I can breathe, introduced me to many resources to resolve important issues, and gave me the education and skills I needed to know how to take care of my parents and myself. To restore funding for this organization and this program would allow other hardworking caregivers functioning on their last ounce of strength and sanity the respite and help they so clearly need. There is so much to gain from restoring the funds to Del Oro and the Caregiver Resource Centers. I am a caregiver, a survivor, a grateful and thankful one. I hope that many, many more caregivers like me will have the same hope, help, and opportunity to enable them to continue serving their loved ones while preserving their sanity. And that will be possible only by doing one thing, which is the restoration of the budget funds. One last note, without respite, more than half of caregivers will die before their loved one, and death of the caregiver is the main reason for early nursing home placement. Because caregivers provide 24/7 care, they experience high levels of stress and negative effects on their health, employment, income, and marriage. There is no work more important, more challenging, or more meaningful than caring for a loved one who is ill. Thanks for listening, and I hope that you can look into this issue and please, like Dr. Laura says, please go do the right thing. Thank you.
Thank you very much.
Hi. My name is Amanda Jackson. I'm a 42-year-old mother of 2 young daughters and a full-time caregiver of my 77-year-old mother. My mom has advanced Parkinson's disease as well as stage 3 ovarian cancer. In 2009, we joined households so that I could assist her with her daily basic care. However, a mere 3 months later, she lost her ability to walk due to a contracture in her left foot. Now faced with her full-time care, I stopped working, doing my best to be a parent and caregiver. I became overwhelmed with stress and not sure how I would continue. I mentioned this concern to her neurologist and was referred to Del Oro Caregiver Resource Center. Immediately called, and since that call, my life has changed for the better. I now receive weekly respite service to assist her with bathing, cleaning, laundry, the simple yet mundane tasks that were in effect pushing me over the edge. Without this desperately needed service, I would be faced with doing it all again, trying to find the seemingly impossible balance of caring for 2 generations effectively and efficiently. Their service is so desperately needed and appreciated. I really don't know what I would do without it. Thank you for listening.
Thank you very much.
Good morning. My name is Rick Rayburn. I'm a retired state government employee, 10 years at the Coastal Commission and 25 at state parks. I retired 2 years ago. My wife is a teacher for 28 years, a reading specialist, as well as a 4th grade teacher in the San Juan School District in Sacramento. And 2 years ago, 3 years ago, was diagnosed with early Alzheimer's, and then she had a virus, encephalitis, that was on top of the damage that was done by the Alzheimer's. And really, at the age of 60, 3 was needed 24-hour care, which I provide her. I don't have my children are out of the area, and when that's happened, it was difficult. It was really tough 2 years ago. It still is. I spend 80 hours awake hours every week caring for her, and I do have some assistants 5.5 hours outside of that come into the house and relieve me. But when the neurologist 2 years ago, after she got out of intensive care, she lived, we didn't know if she would, he said, you got to talk to Del Oro and find out what they can do. And a person came, I called, and I was surprised, sometimes I don't, I go, yeah, okay, whatever. I called, and then the next day the woman was out and spent 2 hours in my backyard talking to me about what I needed to do to get my life, on together. They gave wonderful counseling assistance, legal assistance, provided some respite care for a while until I was, able to get my finances sorted out and take care of it myself. And were just wonderful. And I don't know where I would be if I wasn't able to get that help from Darrow Resource Center. And so I would ask, you guys to, do what you can to augment that program. We're all in this together, and it's going to be a long haul for all of us eventually. And I'm smiling because I just got, Del Oro provided daycare for me for a couple hours this morning. I just got a text from the daycare person, and it said, your wife told me to shut the screen doors because the mosquitoes were coming in and eating the laundry. Oh, okay, whatever. Then you guys can do screen door stuff too. Anyway, thanks so much.
Thank you for your testimony.
Madam Chair, Senator Monning. My name is Travis Bai. I am the clinical supervisor of the Del Mar Caregiver Resource Center, which serves unpaid family caregivers in Monterey, Santa Cruz, and San Benito counties. In 2009, the California Caregiver Resource Center sustained a cut of 74%, one of the largest funding cuts of any health and human services program. This cut forced our center and others across the state to drastically reduce our staff, our core services, and our capacity to serve family caregivers in our community. I am here to speak in support of the partial restoration of $2.9 million to the statewide Caregiver Resource Center budget. As clinical supervisor, I have seen firsthand the powerful effects that our services have on caregivers' lives. Caregivers are able to avoid burnout, take precious time to care for themselves, and receive the emotional support, education, and guidance that they desperately need. They are better able to care for their loved ones and can avoid or delay placement of their loved one in a nursing facility. Unfortunately, because of the 2009 cuts, there are many more caregivers in our communities that need our services than we are able to serve. The reallocation of $2.9 million to the Caregiver Resource Centers would effectively double our capacity to serve caregivers across the state who need our help. We respectfully request your support of this partial restoration of funding and hope it will be a step towards restoring Caregiver Resource Center funding to 2008 levels. Thank you.
Thank you very much.
Good afternoon. I'm Michelle Nevins, and I'm the Executive Director of Del Oro Caregiver Resource Center. And those three caregivers were our clients. On behalf of the California Association of Caregiver Resource Centers and the legions of family caregivers out there that are unpaid, we respectfully request restoration of funding. And to answer some of the questions that came up as the LAO was speaking, full restoration to our system would actually be $8.4 million. We're actually seeking $2.9 million, and that would actually double our capacity of what we're providing now and at least get us a little closer to serving the caregivers that are just amplifying day after day with the baby boomer population in numbers. And as you saw with the caregivers that testified, these are folks that come from all geographic areas and all walks of life. And so I really respectfully request that you restore our funding as much as possible. Thank you for your time.
Thank you very much.
Good afternoon, Alice Kessler. I'm here representing the California School-Based Health Alliance, and I wanted to address the proposal relating to school-based health centers. Just a little bit of background on that. The Public School Health Center Support Program was founded in 2006 and then subsequently augmented in 2008 to establish a competitive grant program to support the growing number of school-based health centers in the state. and that program has never been funded. So we're asking the committee to consider funding for that. California, in fact, is the only state that doesn't have general fund support for school-based health centers. School-based health centers are a great model. They provide primary care, mental health care, preventative care to students where they're most likely to get it right at school. And they are primarily in some of California's most economically distressed areas where we have higher rates of asthma, obesity, diabetes. People are more likely to go to the emergency room or the hospital. So we think this is a smart investment for the state, both in terms of reducing healthcare costs, but also improving educational outcomes. We also have research that shows that school-based health centers improve attendance. And so we think this is a win, and we very much appreciate the committee's consideration of this and the partners that were here today to also support the proposal. Thank you.
Thank you very much.
Good afternoon, members of the committee. My name is Nancy Calvo, and I'm the president of the California Maternal, Child, and Adolescent Health Directors. We represent 61 local health jurisdictions. Our organization, MCH Action, is concerned about the cuts that were to the Adolescent Family Life Program and to the Black Infant Health Program and to the Teen Pregnancy Prevention Program. These cuts resulted over $16 million of funds lost that inhibit our ability as local maternal child health directors to effectively provide services to a much needed population. In addition, we lost another roughly $9 million in federal funds that we were not able to draw down those funds, which again then does not allow us to expand services for a much needed population. All three of these programs are programs that are investments in prevention. We've heard about today about putting our resources in prevention so that we can have benefits as these moms and young children get older. They ensure that they have healthy pregnancies, that they have healthy infants, that they meet the childhood milestones, that they complete their high school education, higher education, that they achieve their life plans. And this, all of these programs also work very with the families very early, so that by being healthy, they are also going to be reducing chronic diseases in the future and requiring further services and healthcare costs. And we have made so many gains in achieving positive trajectories in teen pregnancy, in some communities, infant mortality, and preventing pregnancies among this population, that we want to continue to stay on that course. And we thank you for your support and restoring those state general funds. Thank you.
Thank you very much.
Good afternoon, Madam Chair and members. Terry Calver-Hill on behalf of the California WIC Association. We are in strong support of the young moms who testified earlier today. You heard from them the importance of the AFLP program. We support full restoration of AFLP, of Black Infant Health, and of the Teen Pregnancy Prevention Program. And we hope you'll consider restoration of those three important programs. Thank you.
Thank you very much.
Good afternoon. My name is Dr. Vicki Alexander, and I'm from Berkeley, California. I was a previous maternal, child, and adolescent health director for the city of Berkeley, as well as health officer there. I was the person responsible for bringing the Black Infant Health Program to Berkeley when data from a national scale showed that Berkeley had the worst outcomes in terms of low birth weight babies of any city in the nation of comparable size. The ratio was 4-to-1 in terms of black babies to white babies with low birth weight. After bringing the Black Infant Health Program into Berkeley, after 10 years of analysis of the data, that rate came down to 2-to-1. This is inevitable proof to us that this program works. It's an important program to continue to fund. Thank you very much.
Thank you very much.
Good afternoon, Madam Chair and members of the committee. My name is Sandra Poole. I'm the Policy Director for the California Black Health Network, and I'd like to echo the statements that were in support of restoring funding for the Black Infant Health Program that came before me. Given the disproportionately high rate of infant mortality in the African American community, the funding cuts of 2009 have had a devastating effect on the program, particularly in counties such as Riverside and San Bernardino, who had to totally eliminate their programs. And so I would ask and strongly urge your support of restoration of the funding for the Black Infant Health Program.
Thank you.
Hi, Justin Garrett with the March of Dimes. I'm here in strong support of restoring $3.9 million in funding for the Black Infant Health Program. Thanks for including that item on the agenda. As was just mentioned, these funding cuts had a devastating effect on the program. In addition to the closures in Riverside and San Bernardino, 6,000 fewer women are served by the program now, and the program lost 55 staff statewide. We know that the infant mortality rate for Black infants is still twice the rate for white infants, and for all infants in the state, actually. So there's a very strong need for this program to restore funding for this program in the state. We urge your support. We're coordinating a coalition of more than 50 organizations that are in strong support of restoring this funding. Black infant health is our top priority, but I did also want to lend our support for restoring funding for AFLP. Thanks.
Thank you.
Good afternoon, Madam Chair and members of the committee. My name is Bernadette Ariano, and I'm here on behalf of the California Children's Hospital Association. First, we are in strong support of the restoration of funds for the Black Infant Health Program. We'd like to associate ourselves and support the previous comments made in support of the program. We also are in favor of the Medi-Cal primary care bump. This is very important to primary care pediatricians and also some subspecialty pediatricians, and so we are very supportive of that strengthening of the safety net. Additionally, we are also in strong support of the Song-Brown workforce investment, and Children's Hospitals. We support 60% of the pediatricians training in the state of California, so we are very invested in seeing that number grow, and we want to make sure that those positions stay in California. Thank you very much.
Thank you.
Madam Chair, Senator Manning, Eduardo Martinez with the California Medical Association, in support of several items here. First, I want to thank the committee for allowing a conversation to continue to be had about the governor's proposal on the Song-Brown primary care residency program. A couple of things we think it's definitely a good first start. We support the intent. We think some additional resources to that program would be necessary to sort of move the needle as far as improving access and making sure we keep the physicians here as well. Additionally, we feel pretty strongly that we think really go towards funding new residency programs, as the stated goal of the proposal is to expand California's workforce program, and we're not physicians within California, and we're not sure necessarily that funding going to existing programs that don't commit to expanding capacity will necessarily achieve that goal. So definitely look forward to working with you and the committee on that issue as we move forward. Also very much in support of the issues surrounding Medi-Cal. So we have the primary care bump, which folks have talked about before. That has been really poorly implemented in our review. A lot of physicians haven't even received the bump yet, and that's due to expire in 7 months. Again, the goal of that bump was to incentivize more primary care visits, and yet the enhanced payment actually hasn't been realized by physicians. So obviously we'd love the feds to continue that program, but without that, we think that that should be in place. And then obviously the committee heard the issue of the AB 97 cuts and the reimbursement rates in general, that access to care is severely limited, with California paying 47th in the country as far as what we reimburse for Medi-Cal. So thank you very much for holding this.
Thank you very much.
Good afternoon, Holly Lanebeen on behalf of the California Nurse Midwives Association and the Children's Specialty Care Coalition. We are supportive of the $3.9 million reinvestment in the Black Infant Health Program. We believe it's a really innovative and critical program that has the opportunity to save the state both medical costs and also promote better birth outcomes and reduce infant mortality. Thank you.
Thank you.
Devin Anderson on behalf of the San Mateo County Board of Supervisors, here in support of the funding restoration for the Black Infant Health Program. Thank you very much.
Thank you.
Hi, my name is Sandra Williams. I'm the Communication Director for California National Organization for Women, and we're here to urge your strong support to restore the Black Health Infant Program. Thank you.
Thank you very much.
Good afternoon. My name is Scott Lindstrom. I'm a board president of Time for Kids, also a parent of a consumer for the Early Mental Health Initiative, a member of the California Association of School Psychologists who is in support of Early Mental Health Initiative funding, and a psychologist, school psychologist for 30 years. I want to thank you first for listening to all of our passions here and the intellect and the research that's being presented to you, including what to do with the Early Mental Health Initiative, which has kind of become our beloved homeless child. In 30 years of being a school psychologist, I've watched thousands of kids walk through our doors who are suffering from their own childhood traumas, their own adverse childhood experiences that we've heard about. What I've seen in the process of this is kids that need services that are neglected. We know that research in trauma-informed practices, neuroscience, adverse life experiences, all point to early intervention as key for minimizing the effects of these issues. We know that school-based services provide access for all kids. We know that Emmy grants introduce low-cost, effective services for early intervention, serving about 15,000 kids with the $15 million in grants, also serving another 15,000 with school-wide prevention of addressing climate and bullying issues. We know that the effects were powerful, that none of the organizations that consider funding have argued that they are not effective, just where the funding belongs. And we know that the effects were powerful for every subgroup of our populations. So in the end, we're at a point now where we try to decide these children are all of our children. They're not just the school's children. So how do we fund a program that we know works when we know there's a huge need? And I hope that you will consider supporting funding for the Early Mental Health Initiative out of general fund. Thank you.
Thank you very much.
Good afternoon. My name is Jane Clark, and I'm a parent and a prior Project Emmy coordinator, as well as a former school counselor and now a district administrator. I'm very much in support of restoring funding for the Early Mental Health Initiative program within the general fund. This program provides benefits to all of California's children. The Early Mental Health Initiative is a mental health prevention as well as intervention program provided through small groups, one-to-one services, as well as classroom interventions. Also, as a school attendance review board chairperson, I'd like to point out students who are involved in this program often attend school much more, and they have fewer behavioral referrals. So we see them less in the attendance review board situation as well as in the expulsion process. We do appreciate your reconsideration of bringing this program back through the general fund. Thank you very much.
Thank you very much.
Hello, my name is Alora, and I'm just a mom. I'm with these guys and me, and I do appreciate your time. I appreciate budgets as a business leader and as a mom. Asking for your money is very serious to me. My son, Keelan, came through us through foster adopt when he was 5. He received in his early education very pointed services towards addressing both his ADHD and addressing his social interaction skills that were caused by a lack of human interaction in his first 5 years. He's now 11 and doing great. He receives no more social services, no more funding from the public funding. However, not addressing these problems at that age, I think is akin to not fixing a radiator leak and just waiting until your head gasket blows. He would have had these issues going forward in life and would have spent 10 years not only not catching up academically, but hearing how stupid he was, hearing how weird he was. And so then, as a teenager, young adult, we are now paying public funds, we are now paying societally for a child that is woefully academically behind, as well as now emotionally damaged. Thank you for your time.
Thank you very much. And there's nothing just I'm just a mom. That's a very important job.
My name is Allison Collier. I have 20 years in the school system as a program coordinator and school counselor, and I am here in support of Emmy, the Early Mental Health Initiative. We know the broad and expensive societal costs of not addressing issues early in children's lives. If I can give one example of Joey, we'll call him Joey. Joey was in 3rd grade, and he was referred to an Emmy program because Joey had not spoken to his teacher in 3 years of education. He didn't raise his hand. He didn't participate in class discussion. He stood on the playground watching his peers play. After 12 weeks of intervention in an Emmy program, he got a friend. He began to play on the playground. His teacher rushed in to meet us one day to tell us that Joey had raised his hand. When we looked at Joey in third grade, Joey was not on a path to a positive, productive life. One of the things that we have seen in the longevity studies with Emmy is not only do our children maintain the level of improved engagement after 12 weeks, the studies show that 2 years later, their engagement and their adjustment to school and community and relationships needed to lead a productive lives had continued on an upward trajectory. By placing our young children on that upward trajectory at an early age, we prevent those broad societal costs that we have talked about extensively today. Thank you for your time. I know that there are many wonderful programs that need to be reinstated. This is a crucial one to reduce the cost for all Californians and to reduce the societal cost, not just in money, for our future of our state and our children. Thank you.
Thank you.